Hello, hi, good evening. Hi, this is Christine Crowell here, and welcome to my channel. And today's video is about how you can cut costs in your business without actually cutting down on the quality that you provide within your business. And I really want us to be able to plan ahead and to really be strategic. That's why I did the 30-day CEO challenge. But also in that CEO challenge, I talked about how you can be a CEO in terms of thinking the way the Navy SEALs, Team 6, think about when they are doing their combat, for example, and protecting the country, for example. And I'm just giving that as an example because I really do feel that that is the best way forward to be able to plan ahead so that you're not waiting for the crisis to hit you. If you plan ahead, then you'll be okay. Your business will be okay, and you will have income coming in, and you're not going to see a big drop in income if you start planning now, because you have to plan ahead of time so that you're in the right position when the, say, for example, April 2025 hits you and there's been the changes that have now been implemented, and then suddenly you're waiting for the crash to happen. Okay, so CEOs, let's look at planning ahead now. So rather than think about, we can hear what's going on with the national insurance. The national insurance, that's going to be going up in April next year. So things are going to be increasing. Let's be, upfront here. Things will be increasing, but that doesn't stop you from your business growing and developing, for example. So I'm going to go through some of the things here in the video that I want to discuss with you about things that you can do to protect your business and to thrive during this uncertain time, due to the budget that's happened and all the things that's being said and the chaos that is happening. We don't have to be in that. We can step back and we can plan like how a Navy SEAL would. They would plan, they would have a strategic plan of how they're going to win. And that's what you need to start doing. And you need to start doing that now rather than waiting for the event to hit you. So I'm going to be going through some of the steps that you can do, but I do also have some of my notes here that I will be referring to here. So as you know, the national insurance is increasing next year. So what I would suggest that you look at doing now, and you start looking at your staffing that you've got in your business. Do you really need to have the staff that you have in your business? Can things be cut back a bit? I would be looking at cutting back my staff. I would also be looking at, for example, because in April, what's going to happen is your national insurance is going to go up 15%, which it wasn't meant to happen, but all of a sudden it's come back again. It's going up, so it's going to happen. So your national insurance is going to go up. Your pension, it will be going up as well, that you'll be paying your permanent placements. So I would be thinking about what tax is going to be happening on the jobs that you're giving to people. So as the Chancellor Reeves said, that this is tax on jobs. Let's be upfront and honest. It's tax on jobs. You're basically paying tax just for employing someone. That's dead money. So let's stop paying dumb tax when we don't need to. Let's be real. Let's be, really methodical. Let's look at this as a strategic Navy SEAL plan. Okay. So one of the things, like I said, I would be looking at what staff members do I have in my office? Do I need to have them? If not, then they need to go, because you can't afford for everything to go wrong just because you're keeping everybody that's there. Let's protect the ones that are going out, the frontline staff that are going out delivering the care, the ones that are producing money for your organization. They're the ones that you need to have. And then I would be looking at, because you don't want to be paying more national insurance. Let's be real here. You don't want to be paying more pension either, because that's going to increase as well, for example. So cut back on staff as well. Okay, so the problem is that you want to be able to focus on what savings that you can do. So another actionable step that you can be taking is you could be also looking at introducing virtual assistants. Use an agency. I mean, I've got my agency where I hire out virtual assistants that are trained. They've been trained by me for 8 weeks. We do also ensure that they are compliant. So we do DBSs, we do checks, we do references, etc. Okay, so we do the correct checks. We're also registered with the ICO as well for data protection, for example. I would be looking at hiring virtual assistants for the tasks that can be done, so that you can have your managers that are able to do their job effectively. For example, I'm not saying to cut all the jobs, but cut most of them, because you want your business to survive. And I'm being truthful and honest. I've been there myself, okay? You don't want to get to a situation where you can't pay everyone because things have cut back. That's no good for the whole business. You've got to be strategic. Okay, so like I said, introduce and replace with virtual assistant things that are non-essential, things that are office roles, for example, repetitive tasks. Get virtual assistants in. Like I said, we have a virtual assistant agency whereby you can use one, and if you don't like them, you can change for another organization. Or if you want to have someone permanently, then we can offer that to you, but they will be vetted through us and we charge you a one-off fee. However, we do have the agency whereby we only charge, it's now £8 an hour, for example, for a VA. And that's for them to be supervised by us, as well as being supported with your organization as well. So I would be looking at the virtual assistant route, replacing them with non-essential office staff, for example. So like I said, hiring a virtual assistant, it will save you money, because if you're paying someone a minimum of £12.21 per hour, then really you might as well say, let's add this up here properly. So £12.21 times 15, so that's 183. So just with national insurance, and then there's the minimum wage, you're paying £14.04. That is even without the holiday pay. You've got the holiday pay. Now listen to the videos that I did with the pricing structure, where I did it with a couple of students who are wanting to understand how to get contracts for themselves. So there is going to be another video tomorrow that will be here on YouTube for you to get the next part 2 of that. And there's going to be part 3 and 4 next week as well. So just before you even start, you're paying £14.04. Then there's the holiday pay that you've got to pay your permanent staff members. Then there's any sick pay. Then there's the pension, for example. So all of these things are going to add up. So really, but by the time you turn around, you're probably paying £17 an hour for one permanent staff member to be in your office, for example. Now, like I said, I would immediately be looking at laying that person off in, like, say 30 days time. And I don't mean this to be horrible, because I know the holiday periods are coming up, but you've got to start planning. You can't leave it. Okay. And get a virtual assistant in. You can have, like, for example, 2 for the price of what you would have 1 person, for example, but you only need 1. You only need 1, for example. Cut back, cut back. You need to streamline your operations as well. What things do you have technology wise that you're using? I'll give you one example. Now, we looked at the software that we're paying out for, and we've managed to make a savings of £600 a month. A month. And we are going on an automated system through cloud where things are a lot safer, and there's there's levels of protection. So whoever needs to know, they have that section, but the staff member doesn't have access to all of your information. They only have a small amount. And that's what happened when I had my data breach. Fortunately, I had a data breach, and it happens, even the NHS, government organization, everyone at some time faces it. However, the data breach, thank God they didn't have all of the system, and they actually downloaded the old system. So they got the wrong information. So they were tricked, and they thought that they actually had the latest one, which they didn't. So they actually downloaded the wrong thing. Hallelujah. Praise the Lord. I'm so pleased that they did. However, the only thing that they had was they were able to have the phone numbers and people's names, for example, and the wrong information about what work was done. So if you are watching this, you will know now anyway. So anyway, so like I said, you get the clouds and you make sure that there's a safety in there, which that's what we're implementing in our business now, where it's on cloud and there's only certain allowances in certain section. We do not allow everybody to have access to all people's information. That's stopped now. So you've got to really look at what your security systems are currently at the moment, but also look at what you're paying out technology wise. What can you get that's going to be better, more efficient, that's going to be more automated? Because I tell you what, when I've had meetings in the past and I've had PAs, for example, executive assistants, they've taken like 3 or 4 days to type things up. Whereas now I've got things automated. It can do it within 20 minutes. CEOs, we've got to think smartly now. We don't do things the old way. Let's get into this automated way. Let's think smarter. Let's work smarter, not harder. So get your software, technology, but look at what you're paying out for at the moment. Reduce that. Look at, reducing your licenses. Get that so it's down packed. And I know some of you have got Microsoft. For example, what's the deadline that you have to give in order to stop having that? Because do you really need all those licenses? No, you don't. Okay, let's have a look here. So the next thing is I would review the staff utilization. So do an audit, right? You need to do an audit on your team members for their productivity, and ensure that the employees are working on the revenue, things that are going to generate revenue for your company. Otherwise, there's no point having them there. You're not paying this high price for them not to produce money for you. Otherwise, they have to go. You've got to get mean. I won't say mean. You've got to get real, and you've got to be strategic. You've got to be the leader, and you've got to also make it right for your company to survive. So Check out who's doing your revenue generating tasks. That's who you need to have in your business. Then the rest can be the VAs, for example. So make sure that your employees are focused on tasks that are going to be producing growth for the company. Otherwise, there's no point. What are they doing? You're not there to just shoot, talk a load of rubbish and not do anything. Okay. So the next thing is that you want to look at negotiating with suppliers. So maybe a supplier is charging you even your rent that you're paying for. Start talking to them now, saying, look, things are going to be changing in April. Hello, and I know that you know this as well. Let's look at what I can reduce with you. Can I have a reduction, please? Can I have a reduction, say £100 a month, something like that? Yeah, try and see what you can get knocked off, for example. Then also look at reducing your supplies. So cut back. I know a lot of you like to buy gloves, apron. You got a big cupboard full of stuff, and you know what's happening there, don't you? The staff members are taking it out to either clean their how can I say it? Clean out the rabbit cage, or maybe they're taking it home to do their cleaning at home. Or maybe they've got a horse, they're going out to the horse and they're taking your gloves that should be used for your business. What? Do an inventory and see what the gloves and aprons, the shoe covers, see how often they're going out. Because each person, it should be used for the business only, not for personal use, not to give to a relative. Oh, here you go, here's some gloves here. Yeah, I've got it from the office. Don't worry. You can't do that. It costs money, it's expensive. So you need to be on top of that. So do your inventory, look at your supplies, reduce your supplies immediately. What I'm talking to you right now is about business recovery, protecting your business like a Navy SEAL, Team 6 would do. Let's look at that, cutting back on things that you don't need. That's going to make you stronger. Okay. So evaluate your outsourcing opportunities, what outsourcing can be done that's going to really help you in your organization. Like, for example, your HR could be outsourced. Come on. You don't need to have someone in the office doing your payroll and things like that. It depends how big your organization is. I totally understand that. But let's get real here. Let's get real. Do you really need an HR person? Do you really need a bookkeeper? When I had my office in Worthing, I had a bookkeeper, I had an HR person that was doing payroll. I had too many people. I had 3 floors. I had about 20, I had about 10 salespeople. Then I had consultants as well. It's ridiculous. Everything was going out on staff pay. We got to get real now. We're doing things online. We don't have to have this big, massive office that we're paying thousands of pounds for a month. Then we're paying electricity. Then we're paying the teas and the coffees. Then we're paying for the furniture. And then it's ridiculous. Then we're paying for these desktop phones that we have to pay for. Have a look at your desktop phones. Do you really need to have desktop phones, or can they just all be on your mobile phone? End of story. Start cutting back now. If you want to really beat the system, this is how you should do it. Okay. So evaluate what you could outsource, and outsource it. Get ready so that things are ready for when April comes and everything is running smoothly. Shift to flexible work models as well. Encourage your hybrid team to do remote work as well as working in the office. If, in all honesty, if I could get rid of an office, I'd get rid of it. You don't need it. People can work from home. Then you haven't got to pay 5,000 a month, 2,000 a month, for example. If you're registered with the Care Quality Commission, then is there a place at home that you can have as your office? Get an office built at home, conservatory, or an outside office building, or turn your garage into an office. Directors, CEOs, start doing this now. Start planning now. Don't wait for April for the, for the things to kick you. And then it's like, oh, I can't cope. I'm going to have to close my business down. No, you're going to fight now, like a Navy SEAL would, and do it now. Plan it now. Do your crisis planning right now. You know what the situation is. It's not like you don't know what's going on, because you do. So start planning for it now. Okay. So that is another thing that I would do. Then I would look at, obviously, you've got to make sure that you've got the right mindset. You've got to shift. You've got to change. You've got to pivot. You've got to be prepared like a Navy SEAL. Okay. You want to look at being proactive. You got to cut those costs. You got to cut your costs so that you will survive. It really is about looking at, do you need that office that you've got? Do you really need that? Can your staff members work from home remotely? Do you really need your office staff? Is there some of them that you can get rid of? And I don't mean that in a horrible way. It's about your survival in the company. You can hire people remotely. You can hire virtual assistants that will work for less. Like I said, we're a virtual assistant agency. We charge £8 an hour, for example. And then we supervise the VAs, for example, and they're being trained and supervised by someone who's had 35 years experience. You cannot beat that. I'm also here to help you to succeed in your business, because that's what I want. But I want you to take action as well and be responsible for that. So if you have found what I've said helpful today, I would love to hear your comment in the chat. I know that it may have seemed harsh for you, for me to say, look, start looking at your staff members, start looking at getting rid of some of your staff members that aren't helping to generate revenue for your organization. You want to start integrating some virtual assistants that are from an agency. I'm going to say from an agency because you've got more security, you've got more comeback, you've got more safety net as well. Now, if you want to take them on permanently, then we can also provide that to you for a fee, but they will be vetted and you will have safety in that as well, because they are skilled as well. Okay, so let me know if that's something that you want to start looking at, and then I can obviously speak with you through a free 15-minute appointment, 30-minute appointment. We'll also, meet every 2 weeks to go through what the work is that you need the VA to do, and then you will communicate with the VA with what you want them to do as well on your own back, for example. You really do need to adopt an affordable automation software. Implement this. It's a cost-effective tool for tracking applicants, payroll, compliance, shift management. HubSpot is very good because you've got everything in one place, for example. There's so many things. You can, if you look at this, then you can be competitive with your price. You really can. You can be more, you can get more work than what those bigger agencies will be getting, because your price will be a lot smaller because you've been more leaner. Yeah. So you can then say, right, okay, this is my high price. And then if they knock you down, you can, yeah, let people knock you down, but you know what the lowest that you can go down to. You're not going to go down any lower than that because you're not making any money. There's no point in just doing something just to pay staff members, for example. Business for you. You're in business for you and your family, your loved ones. You want to leave a legacy. You want to give it to charity. Look after that business, because no one else will apart from you. Take it from me. You may think people want to help you. They want to help them, but you want to help you, but you also want to help everybody else. And that is the difference there. You're not out just for helping yourself. You want to make a difference in this world. You want to leave this world in a better place, for example. Like I said, you need to invest in some AI scheduling system to reduce your administration workload. You can even do that yourself. You know, I've learned so much in the past year, and I've realized that I could have worked smarter and not harder by having the AI and the automation system. Okay. There is also the fact that you're able to offer a dynamic pricing module, which is part of the training program that I've started, which is a boot camp, which is about how you can price for your business. You'll be able to introduce a tiered pricing for NHS, for example, for private clients, care homes, in the community, and you'll be able to offer an affordable quality business compared to the large agencies. You'll be able to use, with that savings, you'll be able to upskill your agency staff, ensuring that you hire the best talent and ensure that you're meeting the needs of the NHS, because the NHS, they're not banning everything. They're using some, but if you can be really strategic, then you will stand out. Another thing that you can do is the VA can help with your candidate screening, for example, report generation. You can innovate and you'll be different. It will actually see this challenge that's happening with the Rachel Reeves councillor at Checker and also West Streeting Health Secretary. See that challenge as your opportunity to streamline your business and to bring more money into your business. I see it as a good thing. I really do, even though it's looking bad to a lot of people. But if we plan it now and then crunch those numbers, we can really make this good for you. And that's why I'm doing the dynamic pricing bootcamp module. Okay. You can also look at offering a loyalty program to care homes or to private organizations as well. You know, focus. What I will say to directors, CEOs is focus on the high need areas. They need you. They can't not use you. If you're just generic, then yeah, you're going to be like everybody else. What's so special about you? But if you are focusing on high needs And I know it's difficult, but if the staff members are qualified and competent to do it and they know what they're doing and have been doing so for years, then you haven't got a problem because they will take on responsibility. So focus on the high need areas. You will be able to then look at how you can meet the NHS by providing them with permanent staff members as well. And look at where the chronic staff shortages are and offer a tailored solution for them by you becoming their recruitment consultant. There's a massive need for this right now. You want to be able to automate your compliance and reporting. So make sure that you've got the right software in place that is going to show evidence that you are capable of delivering that service. And this is the type of software that you use, and this is what you are using it for, and what have the benefits been, for example. Provide real-time data. Provide data to be transparent with whoever it is that you're going to apply for the contracts with. They want to know what data. If you don't have any data, then look at what data you can find from the organizations and the government that's going to give you that information. And like I said, expand on hiring VA teams to handle your repetitive tasks, things that are a burden to you. Okay? So introduce your digital operations as well, because you want to work with the 10-year work plan that West Streeton has talked about at the health secretary, but also you do need to do this as an organization anyway, not just for the NHS, but for private organizations as well as care homes, to make you stand out, to make from Joe Bloggs down the road, for example. So become a strategic partner. You want to position your agency as the key partner in the workforce planning and operational efficiency with whomever it is you work with as well. You want to propose your cost sharing initiatives to cooperate and develop further innovations. You'll be able to create apps and things like that with the savings that you're going to make, because we are digital now. So you got to get digital. You got to get really technical in that as well. Make you stand out in the crowd. Become a Navy SEAL, Team 6 member, and work to that standard as the CEO. You'll need to build up your track record. Hopefully you've got a track record which is reliable and of value. So what you should get is the client should get like cost savings. For example, they should be able to look at what virtual assistants that they need, for example, from a reputable agency. You want to be able to implement automations which can reduce your operation cost by 50%. Imagine that, 50% in your business. Come on, we got to get with it. Lower rates, you can offer lower rates. You can become a competitive provider. Offer lower rates because you're making that savings, and explain that because of that savings, you've been able to offer this wonderful rate and still not compromise on the quality of care, so that you are valued. Work on long-term relationships. Offer permanent placement. Don't just do temporary workers, offer permanent placements. You're not going to be pushed out then if you do that with the NHS. They need that from you. So look at their 10-year plan and you work with that 10-year plan so that you're able to mention how beneficial that your organization is to the NHS 10-year workforce plan. So integrate, collaborate, streamline your recruitment processes, offer competitive pricing, collaborate with the NHS, private hospitals, care homes in the community, for example. You want to look at innovation. You've got to focus on workforce retention. You want to offer agency staff training programs aligned with how the NHS career development pathways are, increasing job satisfaction and retention as well. Invest in technology. AI, that's part of it. Automation tools, for example, workforce planning, scheduling, different platforms. And then you want to expand on virtual assistant services. Use an agency that can handle administrative workforce that specializes in healthcare. And I'm not just talking about picking up a phone, calling care homes. I'm talking about compliance. I'm talking about appointments for clinical appointments. I'm talking about doctor's appointments. I'm talking about real in-depth. And these are done by nurses that we have on our books that are trained. It will reduce your burdens by allowing clinical staff to focus on patient care for your clients. You want to be scaling and optimization. You, the business owner, will need to enhance your specialized staffing that you provide in order to get with the program. 2025, that's what they want to see. There's a high demand for mental health, elderly, community care. So upskill your temporary staff members now, because to meet the emerging healthcare needs, create workforce flexibility, and support the NHS in their digital goals and their electronic record systems as well. You want to train your agency staff on the tools that you will need in order to stand out. And then you want to collaborate on workforce planning. CEOs, you need to communicate and build relationships with commissioners, integrated care boards, for example. Go out there and meet them. Don't run from them, meet them, because they're going to be really strong come April here. Okay? Introduce a sustainability program. Align your agency with its operations, environmental goals. You want to adapt a paperless system, reducing the emissions, travel emissions. So if people are working from home, it's a lot better for the environment. And you can mention that it's more environmentally friendly, that your organization is. And support the community. Shift towards community care. If you're not registered with the Care Quality Commission, look at getting registered with the Care Quality Commission. Look at offering telehealth. Look at offering preventative care services. Become more specialized in that. And then long term, you want to offer alliance with your NHS, for example. Offer them workforce solutions so that they will use your services and you will get paid for it. So create a resource where you've got a pool of the best staff members and focus on value added services as well. You want to introduce your agency as a training academy aligned with organizations like the NHS, like in the community. Let the integrated care boards know what you plan on doing. Let the commissioners know what you plan on doing. And all of the GPs, all of the organizations that are to do with the clients offer long-term value. You want to use efficiency tools and innovative care models. You want to contribute, partner with the organizations like the NHS and care homes, for example, but be different. Don't be everyone else. Now is your time to shine. Now's your time to shine, and you got to do it now. You got to shine now, because when April comes, you don't then start doing it now. You got 4 months. We're in November. It's going to be December soon. So December, January, February, March, April. 4 months, because it's 5 months, but I might as well say 4 because December's here. And I don't think much is going to be done because of the holidays, but I won't let that stop me, tell you the truth. So form regular communications. Look at what is happening with the NHS. Be in the news. I'm going to be in the news. I'm going to be telling you what's happening anyway here on YouTube, and also in our Facebook group as well as our emails that we send out. So we're letting people know as well. So look at how you can do your collaborations. What are your matrix? What are your data? What is your agency performance now, and what do you want it to be come April? What cost savings can you implement now? As soon as, listen, it's Sunday tomorrow. You need to get your journal out and start writing out what cost savings can you do in your business, and have that as your plan. You know, your 30-day plan, what you're going to cut out. And let people know, I don't want this service anymore. It ends on this date. Start putting money in your business so that you're ready for when you are hit with a higher national insurance pension, for example. Look at things that are not needed right now. Directors, CEOs, I'm pleading with you to do that so that you're not hit with a crisis come April. And look at what you're paying out, what is necessary, who's working for you that is doing well. Give them a pat on the back. Who's working for you that isn't? It's time to say goodbye to them, because you can't carry on like this. The national insurance is going to increase. Everything's going to increase. The job you offer people is going to increase. You're going to pay tax on it. So look at what is not needed, and you need to let them go. You need to let it go. I hope this was helpful to you, and I would love for you to subscribe to the channel and, you know, hit the notification bell. Comment, let us know what you thought about what I said today. For example, you know, did you find this helpful with what I've said today? And will you be implementing what I have said? Is this something which you're going to get pen and paper to tomorrow morning, for example, tomorrow afternoon, or even now, and start making a plan? Start making a plan, because come April, the national insurance is going up, the pension's going to go up. There's going to be cause and effect from that. Okay, a lot of things are going to go up. So if you plan it now, then you're not going to be hit by the storm. You're the tree, your trunk is strong, you've built the business, you're firmly rooted in the ground. Yeah, that wind's going to come, but you're still going to stand, because you know that you've made that savings ahead of time. I hope this was helpful to you tomorrow. I'm going to be covering crisis plan. This is part of your crisis plan. You need to get on with this. It's urgent, and don't wait till April. All right, so thank you. I hope that you've enjoyed today's training, and I look forward to speaking with you all soon. And I will see you on the internet. Thank you. Bye.